Pelvic pain affects 80% of women at some point in their lives, yet it is often dismissed by doctors, and the root cause can be very hard to diagnose. So a Suncoast woman created a homeopathic solution. Tara Langdale-Schmidt is here to tell us about VuVatech, and she is joined by urogynecologist Dr. Lennox Hoyt from the Pelvic Floor Institute. Tara, thank you for bringing this out into the open, because it does affect a lot of different women. Tell us a little bit about your struggle.
Well, I've had several surgeries for things from endometriosis to other parts of the bodies, but I really dealt with a lot of pelvic pain issues, which cause a lot of, it causes painful intercourse. And through my research, I found that it's something that a lot of women struggle with. So I took an existing treatment for pelvic pain, which was vaginal dilators, that pelvic floor physical therapists use. There's actually physical therapists for the pelvic floor, which a lot of women don't know. And I married it with a treatment for fibromyalgia, which is neodymium magnet therapy.
Okay.
So I incorporated it into dilators, and I made it for myself, and it worked so well that I said I have to help people. I have to help all these women that don't want to take antidepressants and don't want injections and just want something safe to try.
Well, tell us a little bit about your process, because you didn't go into this looking to be an inventor. You got told some things in your journey that you thought, really, that's the best you can do? Like, tell us about that struggle.
So me and along with a lot of other women, we go to the doctor, and I was actually told to drink wine and to take Advil. Like, we haven't tried Advil before.
Or wine.
Yeah, for about 4 years. And after doing my own research, I found a lot of women are told, you're depressed. I was actually told when I had bad endometriosis pain, you need to get off the couch and stop being depressed.
How terrible.
And I said, I actually just can only wear yoga pants because it hurts so bad. I'm not really depressed, I'm just in pain.
But the pain would depress anybody.
There's a difference, you
Right.
know? So a lot of women usually visit over an average of 5 doctors before they're even diagnosed correctly when it comes to vulvodynia, which is what I have. I actually have vulvar vestibulitis, which is a subset of vulvodynia. And it's basically an unexplained nerve pain down there, and it hurts to have intercourse, and some women burn 24 hours a day, and then some women, you know, it's only provoked during intercourse, but it is a very, very big problem, and this is probably one of the only times it's been actually on the news.
Right.
Ever since I've started in 5 years.
Yet
This is the
people do
only-
suffer from
I've
it.
never seen it talked about on the news once.
Dr. Hoyt, tell us a little bit about the Pelvic Floor Institute and what you do.
Hi, so I'm a fellowship-trained specialist in female pelvic medicine and reconstructive surgery, short name urogynecology. Basically what we treat are women with prolapse, urinary incontinence, and certain types of pelvic pain.
How common is what Tara's talking about?
It's pretty common around women, in women. As Tara has pointed out many times, you can't find a diagnosis to explain the source of the pain. Many doctors would look at, you know, ovarian cyst, they'd look at endometriosis, they'd look at various infections of the vulva and uterus. If those are not present, we end up with what's called a diagnosis of exclusion, which is you have pelvic pain. What we've discovered over the years, and there's lots of scientific data to now support that, is that there's a big component of a muscle spasm, pelvic muscle spasm associated with pelvic pain, and some vulvodynia, and there seems to be also a big nerve component, which in the past we were all taught as gynecologists that the pelvis consists of the uterus, the tubes, and the ovaries. And if it ain't them, then it must be in your head.
Right.
And we're starting
Which
to learn.
obviously isn't true.
Yeah. So we're starting to learn the importance of physical therapy and other kinds of treatments like what Tara has
Quickly,
talked
for
about.
women who have pelvic pain, tell us a little bit about some of the options.
Okay, so the most important thing to realize if you're a woman suffering from pelvic pain, get you to a gynecologist to rule out the usual suspects. Endometritis, ovarian cyst that may be torsing, sexually transmitted infections, other infections in the pelvis. Once that person tells you, that gynecologist tells you that we can't find anything wrong, then the next step is to ask for consideration for a visit to a physical therapist, a pelvic floor physical therapist, because often in those women, it ends up being an issue with myofascial pain, pelvic floor muscle pain, that's making it feel like bladder pain. The other thing, urinary tract infections need to be ruled out as well. But there is hope for women.
Good advice, and magnet therapy, we're glad it has helped you and what you've been able to work through with physical therapy. So, Tara, thank you for bringing it out in the open. Doctor, thank you for discussing it, as it is something many women deal with. If you want to learn more about VuVatech, you can go to their website at VuVatech.com. Coming up next, how you can support young women right here on the Suncoast.